Hi, I wanted to put this out there about SI joint fusions because I've just had both SI joint fusions done in the last 3 weeks. One was 3 weeks ago, also with a laminectomy done at the same time. And then the second week after that, I went in and had the other side SI fused. And it's now been a 1 week post-op from that almost exactly. The thing about SI joint fusions is I've read commonly you will end up having to have, or you will have SI joint issues by having a multi-level fusion, which I had a year ago, October, level 4-5 S1 fusion. It's been almost a year since I've had that, and I have continually been in pain thoracically by back, and my SI joints apparently started moving because when you're fused above that, that's what happens. They start moving and you have really bad lower back pain. I put this out there because everything I'm reading, I didn't get a whole lot of information from my doctor about post-op and recovery on what you should be doing and what you shouldn't be doing. And I kind of just rushed out of there saying, yes, hook me up. I was in so much pain. Let's do it. So I went on the internet, of course, which, doctors don't like you to do that, but I did. And everything I read, you will be non-weight bearing, no weight on the side that they fuse for like 3 weeks. You'll be on a walker, you'll be on crutches, all of that. Well, my doctor said, no, you need to walk, which contradicted everything I looked up. I was like, okay. So then they said, you're going to walk right out of here. Well, there's no way in heck that I was going to walk out of that hospital. I barely limped out with a walker and with assistance, a walker into my home and into my bed, because there's no way I could have walked on my own, which they said. So I was very concerned about that. And I called the hospital and I called the nurse practitioner and I told her, I said, you said I'd walk right out of there. Well, you're totally wrong with that. She goes, well, that's the best case scenario. We don't like to tell you the worst because you probably won't do the surgery. So I was like, well, great. She goes, well, just, you just walk. They mean like to walk to the bathroom and back, or walk to the kitchen and back, and then walk as much until if it hurts, don't walk. Okay, so I started doing that. And I started feeling better. But I remember I had two surgeries, a laminectomy on L2 and L3, plus the left side of SI joint fusion at the same time. Then 2 weeks later, I had the right side done, SI joint, and I'm 1 week post off of that. So all I can say is I am walking a little bit. I'll go outside with a cane, and I live on acreage, so I'll walk. I have a very long driveway. I'll walk up and down my driveway or walk around the house, and then I come back in. I got to say, I take a pain pill and I lay down, and I use ice. The swelling is significant. The swelling looks like I have 2 footballs on each side of my hip. So I just wanted to say, I think I'm also 68 years old. So I know me bouncing back is not like a 30-year-old bouncing back. But I want to say the SI fusion, the pain that I had in my lower back, I don't feel that pain. The surgery pain is what I feel. The muscles, the nerves. I've got a lot of strange nerve stuff going on in my legs, down to my foot, that I feel sometimes very sharp pains in my feet that come and go. But I know after having the spinal fusion a year ago that the nerves take a long time to repair and heal. And I think that's where I'm at with that, because it's not consistent. So, and that's my story on my SI joint fusions. I'd say I'm 3 weeks out now from all of it. I'm going to walk around at least 3 to 4 times a day. Try to walk outside and take a stroll. Then I use ice. And that's pretty much about it. But I am still on pain meds because the swelling, if it gets swelled by the end of the day, it's pretty painful. And ice does help. So ice is your friend. Walk as much as you can, but please don't overdo it. That would be my guess. I called the surgery center. I said, well, you didn't send me home with a lot of post-op information. And so when I went in the second time, they did a major overkill on post-op explanations on walk this, you have to walk, and just crazy stuff. And then they're like, then you talk to somebody else, they're like, no, you need to walk at what's comfortable for you. If it hurts too much, you don't walk, don't do it. So listen to your body. They did nothing say anything about non-weight bearing, which is everything that you will read on the internet is about non-weight bearing and needing crutches and walkers. And I do use a cane. I feel more comfortable with a cane, more steady. I don't feel great walking without it. Eventually, I haven't left the house or done an outing since I've had these surgeries. I plan on going out tomorrow for a light lunch, just see how it goes. But I want to put my story out there because I don't hear a lot on it. And please ask me questions if I didn't give any information that was helpful to you. I think just know once you have a fusion, especially a lower lumbar fusion, it leads to more. It leads to issues above the fusion and issues below the fusion, which I had both. And I now have, 12 screws and I don't know how many rods. I don't know, maybe 6 rods or more in my back. So yeah, hopefully this is it. I won't be having this any more issues, and I can move on with my life and become somewhat more useful around my home like I used to be and do my hobbies. But the lifting, the BLT restrictions are in place. No lifting, bending, twisting for 6 weeks, which you know how that, if any of you have had spinal surgeries, that's the protocol. So hopefully this was helpful. Please leave any comments or ask any questions if I didn't cover anything about this. It's just, I was a little frustrated on what I found, even from the doctors on the internet. It didn't coincide with what the doctors are saying these days. And I did go to a minimally invasive surgeon on all my surgeries. He was minimally invasive surgeon because I see people with cuts all the way down their back for some of the same surgeries that I had, and I don't have cuts like that. I have like 1 or 2 inch incisions, they're small, and with the same outcome as people who are having cuts all the way down their back, which I did not want to recover from that. So I did research for a minimally invasive surgeon, found one, and I think it's worked out better for me that way. So anyway, thanks for listening, and I hope it was informative for anyone who is experiencing these spinal issues, because they're no fun. Anyway, thanks.